The listening part of occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract only once. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Polina. For questions 1 to 12, complete the following notes with a word or short phrase. You have 30 seconds to look at the notes.
Hello, good morning, doctor.
Good morning. Tell me, what's your problem?
Well, I have a history of first-degree atrioventricular block and had a pacemaker placement. I feel this problem of decreased eye vision. Last time the problem lasted for about 5 minutes. That occurred 4 weeks ago when I was driving the car.
Then how did you manage to drive?
Well, I was able to pull the car over to the side of the road without much trouble. During that time, I felt nauseated and lightheaded. When I approached the clinic at that time and received a CT scan, carotid Dopplers, echocardiogram, and neurological evaluation, all of which were unremarkable. I couldn't have an MRI due to the pacemaker placement.
Okay. Did that occur again?
No, doctor.
Any lesions or change in vision, headaches, change in gait, or other neurological issues?
No, doctor.
Do you have any back pain, bowel or bladder incontinence, or frank lower extremity weakness?
No, doctor.
What's your age?
57, doctor.
Do you drink or smoke?
I don't smoke, but I drink alcohol, only on some special occasions.
Any past illness or surgeries?
I had pacemaker placement for atrioventricular block, and I had bilateral knee replacement 3 years ago and have some pain in my knees.
What medications are you taking?
I have recently started on Plavix, suggested by primary care doctor. Other than that, baby aspirin 81 milligrams per day, Proscar 5 milligrams GD, and Synthroid 0.2 milligrams daily.
Are you allergic to any medication?
No, doctor.
Well, your physical examination shows your blood pressure at 134/80, your heart rate 60, respiratory rate 16, and weight is 244 pounds. Cranial nerves 2 through 12 are intact, and you have normal bulk and tone throughout. There's no cogwheeling. There is some minimal weakness at the R4 plus or 5, and possibly trace weakness at the quadriceps -5 or 5. You have decreased sensation to vibration and proprioception and vibration. There is no dysmetria or tremor noted. His Romberg is negative. You have developed transient ischemic attack. The character of his brief episode of visual loss is concerning for compromise of the posterior circulation. Differential diagnosis include hyperprofusion, stenosis, and dissection. You have lumbar stenosis. The symptoms are very mild and consist mainly of some mild proximal upper extremity weakness and very mild gait instability. You have to get a CT angiogram to evaluate the integrity of the cerebrovascular system. Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mrs. Emmeline Pethick. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, good morning, doctor.
Good morning. Tell me what's your problem.
Well, I have a Codman-Haycom shunt set at 90 millimeters H2O. Recently, I'm getting acute onset of headaches, and it's worsening day by day. I am unable to sleep. The pain is constant and is worse with coughing, straining, and sneezing, as well as standing up.
What's your age?
40, doctor.
Did you take any medicines then?
Yeah, I've tried taking Imitrex as well as Motrin 800 milligrams twice a day, but it has not provided much relief. Although the pain is generalized, it is quite intense in the frontal region of head. I get a feeling of ringing in the ears. I have been experiencing intermittent blurry vision and dimming lights as well.
Do you drink or smoke?
No, doctor.
Well, I've reviewed your diagnosis reports. Your physical exam reports show blood pressure at 153 over 86, pulse at 63, and respiratory rate 16. Cranial nerves intact for extraocular movements. The shut site is clean, dry, and intact. You have a small 3 millimeter to 4 millimeter round scab that was noted farther down from her shunt reservoir. It looks like there's a little bit of dry blood there. The worsening headaches are secondary to shunt adjustment back after an MRI. You have pseudotumor cerebri without papilledema and migraine headaches. Well, your shunt back programmed to 90 millimeter H2O last time was after confirmation of an X-ray. However, it seems the picture of the X-ray last time was not most desirable. Therefore, I'm planning the shunt back to 90 millimeter H2O again tomorrow. So, you have to have another skull X-ray to confirm the shunt back program to 90 millimeter H2O. That is the end of Part A.